If you've been feeling more forgetful lately, struggling to concentrate, or simply feeling kind of foggy, you might be tempted to chalk it up to aging. After all, most of us expect our memory to get a little weaker after 50. It seems like a normal part of growing older. But here's something many people don't know. Your brain may not be getting enough oxygen, and that lack of oxygen, even if it's mild, can quietly starve your brain cells and mimic the symptoms of cognitive decline. In fact, studies from the National Institutes of Health have shown that poor circulation, shallow breathing, or low oxygen levels can directly affect memory, focus, and mood, especially in older adults. In this video, we'll explore the subtle signs that your brain may be running low on oxygen, what causes it, how it can lead to brain fog or memory loss, and what simple steps you can take to support healthy oxygen flow to the brain, naturally and safely. Let's begin. Your brain makes up just 2% of your body's weight, but it uses over 20% of your oxygen supply. That oxygen is used to create energy, power brain cells, and clear out waste. It's also critical for forming memories and staying mentally sharp. Even a small drop in oxygen can make you feel tired, foggy, or disconnected. And over time, chronic low oxygen can damage neurons, the very cells your brain needs to function. This condition is sometimes called cerebral hypoxia. And while it sounds serious, milder forms are surprisingly common in adults over 50. Most people don't suddenly faint or collapse from low oxygen. Instead, the signs show up slowly and subtly. Here are some common symptoms: short-term memory problems, trouble concentrating or staying alert, feeling mentally foggy or spaced out, headaches, especially in the morning, lightheadedness or dizziness, mood swings, anxiety or irritability, and shortness of breath even at rest. These symptoms are often mistaken for stress, aging, or even depression. But in some cases, the root cause is poor oxygen delivery to the brain. There are several reasons this happens more often as we age. As we get older, our blood vessels can become stiffer or narrower. This can reduce the flow of oxygen-rich blood to the brain. High blood pressure, high cholesterol, or plaque buildup in arteries, known as atherosclerosis, can also play a role. When circulation slows down, the brain may not get the oxygen it needs, even if your lungs are working fine. Many people, especially those who sit for long hours, begin to take shorter, shallower breaths over time. Slouching compresses the lungs and diaphragm, reducing oxygen intake. We don't notice it because it happens gradually, but shallow breathing means less oxygen gets into the bloodstream and less reaches the brain. Sleep apnea is a common but underdiagnosed condition where breathing repeatedly stops during sleep. Each pause can last 10 seconds or more. During these episodes, oxygen levels in the blood drop, and over time this can lead to memory loss, fatigue, and even increased dementia risk. According to the American Academy of Sleep Medicine, sleep apnea affects up to 30% of adults over 50, and many people don't even know they have it. Oxygen is carried through the body by red blood cells. If you're anemic, meaning you don't have enough healthy red blood cells, your brain may not receive adequate oxygen. Symptoms like fatigue, brain fog, or difficulty focusing can appear even if your lungs and heart are functioning normally. Anemia becomes more common with age, especially in people with chronic conditions, low iron intake, or certain medications. It's easy to brush off brain fog or tiredness as a normal part of aging. But when these feelings persist or interfere with daily life, they deserve attention. Many people report struggling to follow conversations, feeling like they're in a cloud all day, needing more naps or breaks to function, or losing interest in things they used to enjoy. These are not just signs of getting older. They may be signs your brain is working with less oxygen than it needs. And the sooner you recognize the cause, the sooner you can do something about it. Tobacco smoke and environmental pollutants reduce the amount of oxygen your blood can carry. Carbon monoxide, for instance, binds to red blood cells more easily than oxygen does, effectively blocking oxygen from reaching your brain. Even if you don't smoke, living in a polluted area or spending time around secondhand smoke can have a similar effect. Over time, these exposures can weaken memory, reduce alertness, and raise your risk of stroke or vascular dementia. If you've quit smoking, that's a huge step. If you haven't, it's never too late. Studies show that oxygen levels and brain function begin improving within just weeks of quitting. One of the most overlooked clues is how you breathe during rest. Try this simple check. Place one hand on your chest and the other on your belly. Breathe normally. Which hand moves more? If your chest rises more than your belly, you may be breathing shallowly. Chest breathing tends to use smaller muscles and pulls in less air. In contrast, diaphragmatic breathing, where the belly expands, helps draw more oxygen deep into the lungs. Practicing slow, deep breathing daily can make a real difference in how alert and clear-headed you feel. You don't need expensive equipment or drastic changes to help your brain get more oxygen. Small, consistent habits can make a meaningful difference. One of the most effective tools is also one of the simplest deep diaphragmatic breathing. Try this. Inhale slowly through your nose for a count of 4. Hold for 2 seconds. Then exhale gently through your mouth for a count of 6. Repeat this for just 5 minutes a day. This technique helps calm the nervous system, lowers stress, and increases oxygen exchange in the lungs. Over time, your breathing patterns may shift from shallow to deeper, naturally improving oxygen delivery to the brain. Physical activity is one of the best ways to boost oxygen and circulation. You don't need to run marathons. Walking, cycling, water aerobics, or even gentle dancing can help increase blood flow and oxygen to the brain. A study in Frontiers in Aging Neuroscience found that, older adults who walked regularly had better memory performance and improved brain blood flow. Aim for 20 to 30 minutes a day, even if it's broken up into shorter sessions. Long periods of sitting can reduce circulation and make breathing shallower. Try to get up and stretch every 30 to 60 minutes. Simple movements, like shoulder rolls, leg stretches, or just walking around the room, encourage blood flow and reduce tension that restricts breathing. The brain needs not just oxygen, but the tools to deliver it efficiently. Blood is about 90% water. When you're dehydrated, blood volume decreases, making it harder to carry oxygen. Mild dehydration can cause headaches, fatigue, and trouble concentrating. Try sipping water throughout the day, and consider drinking a glass first thing in the morning. Iron helps produce healthy red blood cells, the vehicles that carry oxygen. Low iron can lead to anemia, which is a major cause of fatigue and brain fog. Foods rich in iron include spinach and leafy greens, lentils and beans, red meat in moderation, and iron-fortified cereals. Vitamin B12 and folate also support red blood cell health. These nutrients can be found in eggs, fish, and fortified grains. If you're concerned about your iron or B12 levels, ask your doctor for a simple blood test. Sitting for long hours not only affects your muscles, it also affects your breathing. A slouched posture compresses the lungs and diaphragm, reducing the amount of air you can take in. Over time, this can train your body into a pattern of shallow breathing, making it harder to stay alert and focused. Try this. Sit with your shoulders relaxed and your chest open. Keep your feet flat on the floor, and adjust your monitor or book to eye level to avoid hunching. Even posture can play a role in how much oxygen reaches your brain. If you notice persistent brain fog, fatigue, or shortness of breath, it's worth getting checked. Your doctor may review your breathing patterns, test for anemia or vitamin deficiencies, order a sleep study to check for apnea, and examine your heart and lungs for circulatory issues. You may also be referred to a sleep specialist or a pulmonologist if breathing problems are suspected. Don't wait for symptoms to become severe. The earlier you identify the cause, the better your chances of protecting your brain health long-term. Multiple studies now link low oxygen levels to long-term cognitive risks. For example, research from the Journal of Alzheimer's Disease found that people with untreated sleep apnea were at higher risk of developing memory loss and dementia. Another study in neurology showed that reduced oxygen levels, even temporarily, could shrink the hippocampus, the part of the brain tied to memory. This doesn't mean you're doomed. It means the brain is sensitive and also responsive. With the right care, the brain can adapt, recover, and thrive. If there's one takeaway from all this, it's that the brain thrives on oxygen, and oxygen is something we can influence. You don't need to overhaul your life overnight. Even small steps, like breathing deeply, sitting up straight, or walking after meals, can help bring more oxygen to your brain. And with more oxygen comes more clarity, more energy, more memory, and more moments fully lived. Your brain doesn't need perfection, it needs support. And that support starts with something as simple as a deep breath. Thank you for watching Silver Memory. We hope this helped you better understand the link between oxygen and brain health. If this video made you think differently about brain fog or forgetfulness, consider sharing it with someone you care about. Subscribe to Silver Memory for weekly, trusted insights into cognitive health, memory, and aging well. Gently explained, just like this, because every breath matters, and so do you.